everybody. Yep, I'm still alive. All right, just a second here. Make sure I got everything. All right, I got everything here. I know I started up at 1:30. I should have started at 1 o'clock. So I am feeling a lot better, of course. But anyways, that's besides that. So, but thank you everybody for all your warm wishes and get well soons and stuff like that. Can't appreciate that more, and showing a lot of love. Showing a lot of love. Anyways, so if you have any questions or any comments or anything, you can write in the comment section, and I'll be happy to address anything you might have. With that being said, let me just this over here. I got a couple really awesome points. Hey, Carol. So I'm gonna bring this up here real quick. Second here. Okay. All right. So there was a couple people feeling depressed about their lung disease. I'm seeing on social media all over. It's not like it's not common. It's very common. But I want you to understand something here. Is there has been many documented cases of people with end-stage lung disease competing in marathons. And these aren't like little small 1 mile marathons. These are like 30-mile, 40-mile marathons. So I'm just going to go and just go over two of these people. One of them, let's see, so one person, Evan Wilson, who has pulmonary fibrosis and pulmonary hypertension, end stage, completed the Seattle Marathon in under 11 hours, exceeding his expected finish time of 15 hours. He was running for that many hours, and he was competing with other people. Another person is Tanya, and I'm going to butcher this last name. It's Talui. Yeah, Talui. Who had a lung lobectomy, ran the Boston Marathon just 6 months after surgery, qualifying for the event with a strong finish time. There has also been an end-stage COPD person, which I was trying to find with the research, and I found that there were people that were 85. There's one person who was 85 years old, end-stage, ran the Boston Marathon and won, with end-stage lung disease, 85 years old. What's the point am I trying to say? What am I trying to get at? If you look, I'm all for listening to clinicians and doctors, especially somebody like me. I'm a clinician. I'm a pulmonary practitioner, by trade. I've been doing this for over 25 years now. And everybody says, why do you keep going, or why do you some of these people are end stage, and why don't you just give up type of thing, or it's like, because to this date, all these people that have came to me, some of them are sicker than others. It all depends on the person, right? Some of them are a lot sicker than others. Some take a lot longer than other people, but all in all, they're in this program because they are trying to do what? Build their life back. Get their life back. Be able to walk a mile or 2 miles without stopping. I'm not saying run a marathon, but it's not like I'm giving anybody any false hope. This is something we've done, from weaning people off oxygen to increasing in lung functions and all that stuff. And I mean, isn't that what you guys want? So I'm not sure why people think that, it can't be done or something like that. We do it all the time. Like, if there's a shot of improving somebody to that level, I mean, we're the best shot there is, because we're breathing specific. We go over different types of breathing exercise techniques and things like that really have to be governed. And, we get people that have a very hard time breathing and have really complications, severe complications with their lungs, being able to go back to work going back to taking a walk around the park again and going back out and enjoying their life. These things, lung disease shouldn't be something where, okay, that's it. I'm gonna, crawl up into a hole and bury myself, type of thing. That is just absolutely absurd. You know, I've been doing this long enough, and also Dr. Shaw has been doing this long enough, and all the other clinicians, Melanie Klein has been doing this long enough, where we always see, not sometimes see, always see a person that comes into a program looking like life is lost, and then regaining their confidence and building up their stamina back up again. I mean, you can call it miracle. You can call it a miracle, but it's really not. It's just common sense therapy. It's just what happens. So, for anybody who's feeling depressed, understand it's not just hope. It's a reality. This is something that we've seen all the time. But the only way to get better is to really start to get to work into it. It's only going to last a little bit just to pick up pick yourself back up. And I know a lot of people here have a hard time breathing. You're getting, mixed feedback from maybe your doctor saying that, doctor tells the patient, oh, you can't get better. There's no increase in lung function. That's not possible. Like, yeah, how old is that doctor? And that doctor know about the new advances in medicine? In therapies and stuff like that. We're doing some really amazing stuff, but that stuff did not exist 40 years ago, 20 years ago. I mean, I started the first program in North America for pulmonary rehab. I did. I went to Medicare, went to, a lot of government officials reached out to me during COVID when these things happened and asked us to help out. But we knew what we were doing. We knew what was in stake and what was happening and people dying left and right. And we dropped hospital readmission rates down to 2.4%. 2.4%. That's the lowest in the world. The chance of people going back to the hospital is very low, very, very low with us. The national average is a 30% readmission rate. We're at 2.4%. Yeah, I'm feeling a lot better now. I got a little sniffles, but that's it. So I had to take another one of my magic, I don't know what you will call it, elixir. I had to take one of my magic potions, in a sense, to fix me back up. So it worked out. It's a regimen it's an old-fashioned regimen that I go to. Well, so when I'm sick, I'll consume these certain things, and I'm only sick for a little bit. And it does work, and it really does work. Case in point, my wife was sick for about 2 weeks, still feeling it. Me, I was sick for just a couple days, and that was it. So, and no, it's not a recipe thing that I want to give out, but if you really want to know what I do, it's not something I would say I would tell a patient to do, but it's something that I do. It's my regimen. Everyone has their little regimens, some people use, they'll do whiskey and onions and garlic, and they'll drink that or something like that. I'm not about that. They feel like it works for them, and some other people have different type of, regimens. So mine is based off of these mountain people that live with no electricity, no heat, no electricity, no television, no radio, no nothing, no internet, nothing. They live by themselves. And I know one that's in South Carolina. I never met the person, but it was a TV show called Mountain Men. And these people have this one main ingredient that they say if they don't have it, they won't live. And it was kale. So I started looking more into it, and I saw that when these people got sick, they never went to a hospital. They consumed certain things so they can overcome the sickness, and they're only sick for a couple days Well, I was really curious in what they were taking, especially as a clinician. So what I found out, they were taking kale, about 4 or 5 leaves of kale, like the bushy bits of kale, 2 tablespoons of garlic, 1 teaspoon of ginger, and this honey. It's bambuca honey or something like that. It's a funny name, but it's an antibacterial type of. It has some properties in it that are antibacterial related. And they put 1.5 cups of water, and they mush it up into like a drink. So I just blended the living daylights out of it, drank it, and I've been doing this for some time now, and yes, I overcome my sickness very quickly, But I never say that. Oh, you should do this, because it's not proven. It's just something that I feel that works for me. It's a raw honey, but it's a different manuka. Thank you, Allison. Manuka honey. That's what it's called. Thank you, Patricia. So they mix those things in. I did it. I did it in the past. I do it because I don't get sick very often. Maybe like once a year, maybe once every 2 years. But when I do get sick, I'm out. But every time I get sick, I'll consume the same thing, and yeah, just I'm not sure if it's considered a miracle type of regimen, but it fixes me up, Anyways, but I am feeling a lot better. Well, we have a snowstorm coming up. 20 inches. 20 inches. So what can we do if there was a power outage or anything like that, huh? What should we do? But yeah, I am feeling better. Thank you so much, Allison. So how much honey was it? It was, they put in 1/3 of a cup. I put in 3 tablespoons, and it did the same thing, but that's how much I used. Yeah. Like if somebody had problems with circulation problems, or having a hard time oxygenating, their blood is very low in oxygen, people will consume beetroot, which is nitric oxide, and that will actually spike the living daylights out of your oxygen, especially when you have oxygenation problems. And the beetroot is widely known to work very well. I was a little skeptical at first until I tried it, and I realized, oh yeah, it does work. Definitely works. But there are all sorts of types of regimens. But let's go back to this real quick, because I want to work out, but I want to just kind of settle this up a little bit, and my sinuses just a little bit, before I start working back out with you guys. But and I apologize. I'm sorry. I just want to make sure that I feel better. So, because back is still a little sore from all the coughing and everything, but it was just like one day of severe sickness, but then it was the next day. I would say it was about 3/4. About 75% relief from that on the next day, but I was still having that 25% of congestion and other things. But yeah, it worked out really well. But let's go back to the snowstorm. So it's obviously there's going to be a big snowstorm coming up in Sunday, but it looks like they're saying it's going to probably start around Friday, maybe on Friday, Saturday, and then the most we'll get is on Sunday. Don't know. We don't know how the weather's going to play out. But let's kind of keep a couple things in mind. If your power goes out and your oxygen is dropping, and you have no backup battery or anything like that with your concentrator, what can you do? Well, what you really want to make sure you have is a backup supply of oxygen, like in a bottle, just in case. So E-cylinders, anything that are pressurized, and any pressurized tanks that have oxygen, just make sure you have a decent supply of it. Because I would expect power outages from 20 inches, because you know how weather works. They call 3 inches, and it's maybe 3 inches on one side of the state, while there's 2 feet on the other side. Now we're looking at 20 inches. It's going to be 20 inches on one spot, but it's going to probably be like 4 feet on the other side. Because as wind pushes and stuff like that. So, yeah, we're not sure what to expect, but we got to be ready, right? So humidity is lacked when it's very cold outside. Humidity, so you want to make sure you have some type of humidifier or some way to, or else air is going to get too dry and you're going to have nasal bleeds, right? So humidifiers, heater, proper heater. So if you have a space heater, just make sure if you reside in your room the most, you put that closer to where you're at, but just also keep in mind that heat and oxygen don't do very well. They're very attracted to each other. So too much heat might actually cause a spark, and of course pure oxygen or anything close to pure, like even at 95, 93% pure oxygen coming out through your concentrator, which usually that's the purity that's coming out. Air is concentrated into a concentrator. So the air comes in, pulls out the nitrogen, the helium, the hydrogen, it pulls out everything. And then what is left is oxygen. So what you're receiving from the concentrator is nearly pure oxygen, but it's not 100% pure. It's like 93, 94, 95, 96% pure, depending. So if you're lacking heat, or if it's too cold inside the house, of course, you just want your backup supplies. So backup supply of oxygen. How much oxygen? Not sure. If you live away, like let's say you live pretty far away from the nearest facility, I would say double bulk up on the oxygen, just to make sure, if you wear supplemental oxygen. If you are next to a facility, I probably wouldn't worry about it too much. If there's an emergency, I'm sure they'd be able to reach out to you, hopefully, right? Having an emergency numbers, I would recommend not shoveling snow. It's just, the only reason why I say that is when you have lung disease, heart disease, and you're shoveling snow, it does play quite a bit of a work on your heart. And it is pretty common to have heart attacks, people having heart attacks during snowstorms, because they're trying to go out and shovel snow, and it's taking quite a bit of a load off of them. Anyways, here. Oh, right. Okay. Does anybody have any topics you want me to bring up? Any topics? You can talk to me about anything. I'm leaving this an open forum. So please communicate with me. What would you like me to review with you guys? It could be anything. I'll wait for some answers here, or some questions at least. You're late? All right, Helen. You're late. Okay. All right. But does anybody have any questions? You want me to review anything? The walking and breathing? I can do that. I can do a lot. We can go over anything. You can bring up a medication. Come on, guys. Come on, everyone. Come on, Helen. Come on, Sharon. Come on, Patricia. Come on, Allison. Give me a question. Give me something that you want me to work on. What do you want me to talk about or bring up or discuss? Anything. Give you guys a little more time there. Okay, the Delta V, how to get the right setting. Walking and breathing. I love it. Using too much medicine in a panic. It's not a bad topic. I like that topic, actually. Let's see, I'm going for my COPD review next week. What should I be asking them? Your COPD review, getting off oxygen. Well, Mike, food problems. Okay. Well, those are pretty good topics. Those are actually excellent topics. So first off, getting off oxygen. Let's go over the easy ones. Getting off oxygen is not complicated, but there are certain factors we have to play in. Not saying that can't be done or something like that. We do it all the time. But for somebody to come off oxygen, first, what's the reason you're on oxygen? Some people feel that they're on oxygen because they get out of breath and they need the oxygen. Well, the oxygen itself can cause hypoventilation, meaning when somebody has the urge to take a breath, it's usually based off of CO2 stimulus. When they wear a lot of oxygen, the body is like, okay, that's way too much. It slows itself down, and when you're wearing supplemental oxygen, it makes it feel like you're okay, but you don't realize there might be not enough there might not be enough carbon dioxide being released because you're oversaturating your blood with oxygen. So coming off oxygen is not a complication, but there are some factors. So the first factor is where are your lung volume? Like how high are you getting on your incentive spirometer? How high are you getting on that? Because if you're getting close to 2,000, 3,000 milliliters and you're at least 6 feet tall, 3,000 is good, 2,000 is not enough. So you need a larger lung volume for more surface area. Think about this. Every time the lung opens up, the surface area in the lungs, the larger the surface area, okay, the more oxygen comes in. So if I'm breathing in a little bit, like a little shallow, then I'm only probably going to bring in maybe a couple tablespoons of oxygen, right? And when I exhale, I'm only exhaling a little bit of carbon dioxide. If I breathe in deeper, more oxygen comes in because more surface area. And as I exhale, more carbon dioxide comes out. So is it beneficial to breathe deeper or shallow? Of course, deeper. But how deep? Deep enough for a chest rise. But you got to find out where your volume is at on your incentive spirometer. The calculation formula, the formula for it is 65 milliliters per kilogram of ideal body weight. So somebody who's 6 feet tall, ideal body weight, let's say, is around 80 kilograms. So 80 kilograms or 82 kilograms multiplied by 65 will give me 5,330 if my math is right. Trust me, it is. Buffy! Sorry, my puppy. So if the person is closer to 4,000, chances are they can come off oxygen no problem. But if I take that person off oxygen, are they going to go back to breathing shallow again? Because they have that habit of breathing shallow when we did all that work to boost up their volumes. So getting off oxygen is not a complication, but you have to be in a program that works on that specifically. And the HRN program and the Mind You Lungs program specifically does that. Okay, it does a lot more, but if that's your main goal to come off oxygen, you have to boost up your volumes. I promise you, it's the only way. Okay, but it is doable. Trust me, it is. I do it all the time with everybody. Let's see. All right, I'm going for my COPD review next week. What should I be asking them? It's a good question. So if I'm going in for my review, let's say if I was going into the doctor's office for a review, the questions I would ask is first, where are my lung volumes at? And are the medications I take sufficient for those volumes? I found out from a respiratory therapist, me, that volume is everything. If the volume is too low, then a nebulizer or nebulized medications would be proper fix for that person. If the volume is high, then meter dose inhalers, dry powder inhalers would be sufficient. If the doctor says, well, these will be fine, then I would take the medications the doctor relates or wants me to use and look them up. Look them up on the FDA.gov. Just double checking to see if the volume measure, like if volume. So you would look at the what amount of volume do I need to allow deposition of that certain medication to reach down into my lungs? What's that volume? And if they say it's all right, it's 20%, if it's 50%, if it's 60% of the 65 milliliters per kilogram or anything. Or if you don't know and you're not sure, bring it up with me. I'll look it up for you. But all drugs that you're supposed to be using, as well as consuming, they all have side effects. They are all going to have some requirements. You just have to make sure you have the right requirements. Now, as far as lung disease goes, if I'm going in for the review, I would be asking about the medications. I'll be asking them about going in for pulmonary rehab. Would they recommend going in for pulmonary rehab? I would also be asking, what are my limitations? What should I be looking out for? My oxygen, where should my oxygen be at? You know, make sure you're talking to a pulmonologist about that. Can you talk about that to anybody else? They're going to say, oh, you got to stay above 95. That's not true. Okay, that is not true at all. We have people sitting at 83% oxygen, and that the doctors and that person, that's their normal. That's not low, that's their normal. They're not going to die from that. You know, just people get this weird obsession with oxygen all the time, and they're thinking oxygen is the number one thing they need. No, they need ventilation. There's oxygen and CO2. So you have to bring in the oxygen, you have to get rid of the CO2. Ventilation is everything. Okay, let's see here. I hope that helps, but using too much medicine in a panic. Carol, that's a tough one to review. But I mean, I can go over some things with that. I don't think I'm the best person for that, honestly. Talk about it. Because that's more on the psychology side of it when somebody's anxious. I mean, we do work with people with anxiety, but let me get an input from from Dr. Shaw about that question, and I'll be happy to address it. Let's see. How often should you work out? Working out, if I'm going to start a workout and I haven't worked out for a long time, I always start very light. Always very light. And I always keep myself hungry, wanting more after my workout. If I overexhaust myself by going into one of my machines and next day I'm super sore, I'll probably not look at that machine for about a few months maybe. But if I work out for, let's say, 5 minutes at first, something very easy, and after I'm done, I feel like, oh, I have so much more energy, I can keep going, I'm just not going to. I wait the next day and I'll go for 6 minutes. I'll go the next day after that, go to 7 minutes. I'll work my way up to 25 minutes of working out. I'll work out for, a good workout is 25 to 30 minutes, 3 days a week minimum. But a workout, what constitutes as a workout? Something that increases your heart rate by at least 10 beats from its baseline. So if your normal heart rate is 70 beats per minute, if you go up to 80 beats per minute, that's a good start. If you go to 90 beats per minute when you're working out, that's even better. It all depends on your age. So when we look at age, we look at the person's age, we take the number 220 subtracted by their age. That gives us their maximum heart rate. So we take that maximum heart rate and multiply it now by 0.7 or 70%. That will keep that person at a moderate intensity so they can develop a tolerance to a certain severe or moderate exercise. It's the only way to decrease someone's work of breathing. I hope that helps. Let's see, when I have coughing spells for some reason, I end up sneezing a lot afterwards. Is this normal with COPD? No, not really. I mean, it could be, some sinus inflammation, maybe. But no, it's not common. When somebody coughs, they sneeze. Yeah, it's not a common thing, but it doesn't mean that's something that's severely abnormal. It could just be from, sinus infection, or it could be, an allergy still persists, kind of around you, in your environment maybe. But no, if you have any problems with that, I would definitely bring it up with ENT or pulmonologist. Would be just fine. Let's see. Could I ask? I've had peak flow test Monday. Classes classed as very severe. Could I get better lung functions if I started to walk more? It's a good question, Helen. Walking itself does not, and please understand, I've been doing this for some time, right? So, and I know that's why you're asking me. But walking by itself does not improve the lung functions itself. Respiratory muscle training works lung. See, if I'm working out my legs benefit. Don't get me wrong, it'll help my heart depending on the severity of the exercise. But if I'm working out my legs are going to get stronger. If I'm working out my arms are going to get stronger. You got to work out those lungs. Respiratory muscle training is really the biggest key is building up the lung volumes so the person can handle a walk. It's not that your legs don't work, it's that your lungs won't carry you to where you want to go. So as far as better lung functions, you're going to have to go with respiratory muscle training. I promise you it'll work. Let's see. Hi, Alex. I'm new to your program. How often is your live programs? So the live programs here are Tuesdays and Thursdays at 1 p.m. at Eastern Standard Time. I did come in a little late today because I was just cleaning myself up a little bit and getting myself out of bed as I was a little sick. So that was my apologies. But the classes for the HRN and the My New Lungs, those are Monday, Wednesday, and Friday. And you have the autonomy to come into class so I can physically see you. It's all through Zoom. So I can physically see you. The class times are 9 a.m., 10 a.m., 11 a.m., then it's 1 p.m., 2 p.m., and 3 p.m. And you can come in anytime you like to try it out. The max I can ever have somebody come in for free, I believe it's 2 days. But if you tell me you just need an extra day, I'm probably not going to say no to that. But it is a subscription base, unless you have insurance, and then it's insurance based. I hope that helps. I will be starting. I have review on the 29th. Can you send me a Delta V? Yeah, we'll send you a Delta V. I'm not the one who sends the. It's a whole company. I'm with the company. Though I started the company up, I'm not the main person anymore. I was not anymore. I'm still the CEO, but it's a whole team that does the work. So, but no worries. No problem at all. But yeah. Okay. 2,000, Mike. How tall are you, Mike? 2,000 is not horrible, but it really depends on how tall you are. So if you can give me your height, then I can be helpful. Let's see, how much? I have too much CO2, 52%. Should I be able to have less CO2 if I use less oxygen? It depends on how much oxygen you're using, but remember it's not always the oxygen, like the supplemental oxygen, all the time. It also has a lot to do with how deep you're breathing. If you're not breathing deep enough and your chest is not rising, you're not going to get rid of enough CO2. It doesn't matter about your oxygen. There's a lot of key factors in it. That's why it's not like, all right, I'll give you an answer and you're good to go. You need clinician help. You need a clinical help with that. We review everything. We look at everything. We see everything. That's what we have to do, or else we might cause harm. We might, make a problem even worse, So we don't want that to happen. So the best thing I could say about that is come into the class so I can review it with you and I can test you. And yes, it's all done through Zoom. See, why do my ribs hurt constantly? Well, either you're a boxer or you do some type of fighting on the side, Sherry, or you're doing respiratory muscle training and you're sore between your ribs, which is common. If you want to stay sore for a very long time, don't do anything. If you want to stay only sore for a short period of time, eat plenty of protein. Make sure you're doing stretches and you're hydrating enough. Potassium, electrolytes, and that soreness should subside rather soon. If I'm sore, I'll consume a lot of food. If I consume a lot of food, I'm not sore for a very long time. If I don't consume enough, I'll probably stay sore for about 2 weeks, and I don't want that. So it just depends on what you want. My body can barely carry my body weight for about 5 minutes. Help me. Dottie, come into the class. Why don't you guys just come into the class? Why just wait and wait and wait and procrastinate? Come in the class. You guys know how to get in the class. Look, you just go to the Home Rehab Network webpage, enter appointment, scroll down where you see my face, right? Click underneath my picture where it says enter appointment, and that takes you directly into class. Just come into class Monday, Wednesday, and Friday. Yeah, I'll be happy to bring you in. It's not a problem. They told me I was severe last year, but I'm only on a LAMA inhaler. For anybody who does not know what that means, LAMA inhaler is long-acting muscarinic antagonist and long-acting beta agonist. It just means that the muscarinic antagonist that causes the bronchial valves or the airways to constrict and inflame, it prevents it from doing that. That's what that is. Can't pull it deep enough, so I keep trying. Gotcha. Well, remember, this is not going to do the justice. This is just to measure it. So what's going to do the justice is the delta V. And I know somebody asked, how do I set the delta V, which I'll go over in just a second. Dottie, then just come in. Come into class, everybody. Yeah, come into class. Just come into class. Stop talking about it. There's no excuses. I'm giving you a free ride to come into class so I can at least check you out. So come into class. You think the company's going to say no to me? I own the company. Just come into class. I can't give freebies to everybody all the time, but I can at least have you come in for a day or two to at least get something out of it. And then if you're really serious, use your insurance so you don't have to pay anything. Or, use the Mind You Lungs, which is a subscription, and you have me. There you go. But at least try it out. Come on, you know that I'm a good one. See why I'm a good one, You mentioned respiratory muscle training. What is that? Respiratory muscle training is where I need to do exercises for my diaphragm and the muscles in between my ribs, which are intercostal muscles. That helps pull the lungs open further. Okay, that's these muscles, the diaphragm and the intercostal muscles, are primarily responsible for opening up the lungs for ventilation. So you can pull in oxygen, CO2 comes out. How can I improve that? Your breathing is not it. We'll review that. I'll go over that with you guys. No problem. I'm responding to Quilting Pammy. It's an awesome name, by the way. I love that name. Quilting Pammy. I love it. Thank you, Alex, and the Home Rehab Network. I learned so much making my COPD more manageable, understanding this disease. Thank you. To you. Oh, you're very welcome, Denise. Thank you so much for that. Well, let's go over of how to set the delta V, okay? So first off, this is a delta V. The big triangle here points at the number, okay? So right now, as you can see, that big arrow or that big triangle right here is pointing at the number 6 because I know that's my setting. Hey, baby. What's the matter? You want to say hi to everybody? Come on. I got my little antidepressant right here. Look at this thing. How could you be sad with a face that looks like that? Huh? Yes? What do you think? Yes. Mwah. Just wants to say hi. Look at that. Oh my goodness. Look at that face. She is so cute. It is absolutely crazy. Anyways, I love that thing. I love that little girl. Yes, I love you so much. All right. Anyways, so there's the Delta V. This right here is an adapter aside. Right here, this I can attach to different devices. This right here is the mouthpiece. Okay. Right here is the dial. This big square right here with the triangle is called a rotation block, and I'll show you how this all works. So what we would have to do is we would take an incentive spirometer, and we would take the original mouthpiece off of it. As you can see, I warped the living daylights out of this. This is all funky looking now. It's not great. I don't think I have another extension or another piece of corrugated tubing with me. That's okay. Anyways, I take the Delta V. Here's the adapter setting. I set it in its place, just like that. And now, I'm ready to find out what setting I should be at. So, to do this, I have to understand that I have to find out how strong my muscles are. So, if I was going to do a measurement, now as I set this dial, I can rotate this block so I don't readjust the dial. So I can rotate, that's why it's called a rotation block. You can rotate the mouthpiece. If somebody says, why should I have to do that? Well, because if you set the dial and then you're ready to go and it's at an angle, you would have to move your head like this, or you might accidentally, if you turn this, you'll reset the dial to a different number than what you wanted. So that's why there's a rotation block in it. Anyways, so here's the rotation block to rotate it where it's in line with my mouth. Right now I have it set to a 0. So the 0 is made to use the incentive spirometer for its intended use, and that's to measure my volumes. Now, if I am not going to measure my lung volumes using the incentive spirometer and I want to find out what setting to be at, I would have to change the setting of a 0, move it over, and I'm going to first set it at a 7. On this incentive spirometer, this right here with all the numbers will not exist for this test. Right here, this float, this is what I want to use when I'm trying to find out what setting to be at. So this float right here, now this top arrow is my big money maker. That's what I want. That's the sweet spot. So if I inhale through here as fast as I can, and this float is below the top arrow, anywhere around here, if it's below the top arrow, that means this setting that I have it set to is too heavy. It's too much resistance. If the setting I have on there keeps the float all the way to the top, it means the setting on the Delta V is too light. If whatever setting I have is at least at the top arrow, it means that the setting is perfect. So here I go. The setting of a 7. I'm going to breathe in, look at the float. Let's see if this is the right setting for me. Because it's below the top arrow, the setting of the 7 is too heavy. So I'm going to reduce the setting down. I'm going to try this one. Remember, I'm breathing in as fast and as hard as I can. So this setting stayed to the top. That means now this setting, which was a 5, is too light. So I'm just going to find the proper setting, which I know my setting. And all I'm doing is breathing in as fast and as hard as I can. So here we go. And that's staying usually on average at the top arrow. That means that setting of a 6 for me is the proper setting. So now that I have it set to its proper setting, then I can put it into use. I place this in my mouth. I'll have 4 seconds to fill my lungs up all the way, 4 seconds to empty my lungs. Okay? I'm always going to count above 4 seconds for you to keep trying to inhale and encouraging a deeper breath. That will improve and keep the muscles at a constant state of tension, trying to pull open those lungs, and those muscles between the ribs and the diaphragm will get sore, but they'll start building up. So if you're feeling sore, you're doing the right job. The job is actually working out. I hope that helps. Yeah, you can. You can't get a Delta V in Canada. We have patients in Canada. Of course you can get a Delta V in Canada. Cute Frenchie, isn't it? Yeah. I got a big bulldog too. I got 2 bulldogs, 1 pug, poor thing is dying, and a Frenchie. Let's see. Yeah, we can do it next time. That's not a problem. But looks like that's all the time I have for today. Okay, we'll say Tuesday, 1 o'clock. We're going to work out. Workout will be strength training. Thursday's workout is going to be walking and breathing. Some strength training, but it's going to be more cardiovascular. Okay? So keep that in mind. I'll see you guys at that time. All right?